Hi everyone. In this session, we are going to see behavior change communications. Shortly we can call it as BCC. I am Dr. Beulah Dallas, HOD of Community Health Nursing Department, M College of Nursing. So what is BCC? It is a research-based consultative process that uses communication strategies to promote positive health behaviors and create supportive environment. The objectives of this BCC are to inform people on healthy behaviors, to motivate people to adopt healthy behaviors, to empower people on the practices of healthy behavior, to adopt and maintain healthy behaviors. So we are changing the behavior by informing, motivating, empowering. At the same time, we are encouraging them to adopt and maintain the healthy behaviors to promote health. The definition, according to Sharma 2020-22, they says BCC is about influencing behavior at the individual, community, and societal levels through planned interventions grounded in theory and evidence. According to Naidu, stresses that behavior change communication is participatory, people-centered, and context-specific using interpersonal, group, and mass media approaches. Why we need this BCC? Earlier, health education focused more on knowledge transmission, assuming that information alone would result in behavior change. However, evidence has shown that knowledge is necessary but not sufficient. Behaviors are shaped by psychosocial, cultural, economic, and structural factors. BCC evolved as a response to this, focusing on communication that addresses barriers to change and strengthens self-efficacy, also social support. That's why we need this behavior change among the people. The strategies of BCC. There are 6 strategies are there. The first one is advocacy. Advocacy means it is aimed at policymakers and leaders to create enabling the environments, promote political will and resource allocations. And the second one is social mobilization. It is engages the community leaders, groups and the influencers to build the collective action. Interpersonal communications. One-on-one or small group interactions through community health workers, nurses or peer educators, we can try to change the behavior of the people. The other 3 strategies are mass media campaigns, that is use of radio, television, social media, billboards to reach large audiences. Through this mass media, we can promote to change the behavior of the public. Participatory methods, that is community dialogue, theatre, storytelling and other culturally sensitive methods can be used. Digital and m-health tools, that is use of SMS, mobile apps and digital platforms for behavior reinforcements. These are the strategies we can enforce or motivate or encourage the people to adopt the healthy behaviors. The next one is implication of BCC. Encourages long-term behavior change rather than temporary awareness, strengthens health systems by promoting demand for services, facilitates community ownership of health problems and the solutions, requires intersectoral collaborations including education, media, health and civil society sectors. The components of BCC are perceived susceptibility, belief about the likelihood of getting a conditions. Perceived severity, this is belief about the seriousness of the conditions. Perceived benefits, that means belief in the efficacy of the advised action to reduce the risk. Cues to actions, internal or external triggers prompting the behavior. Perceived barriers, belief about the cost or obstacles to taking the action. Self-efficacy, confidence is one's ability to take action. Let's see the steps or process of BCC. There are 6 steps are there. First one is pre-contemplation. Pre-contemplation means here the people are unaware or unwillingness to change. And the second thing is contemplation. Here they are thinking about change, whether can we move forward to adopt that behaviors. So here the third steps, that is preparations. Here the people are getting ready to act to take that change. And the fourth one is action. They are adopting new behavior. And maintenance, after adopting it, they're sustaining the behavior. And the next one is relapse, that is the optional steps. They will return to old behavior. If they are not satisfied with this new behavior, they will be going back to the old behaviors. What are the advantages of this BCC? Evidence-based, uses proven models and research. Empowering, builds knowledge, skills and confidence among the people. Sustainable, promote internal motivations and long-term change. Flexible, adaptable to various settings and populations. Community focused, encourages the participation and ownership. What are the factors affecting this BCC? First one is individual factors. That is knowledge, attitude, belief, motivation and the self-efficacy of the individuals. If they are knowing about the particular importance of the behavior change, and they're having the healthy attitude or positive attitude, that will be a healthy belief that can be motivate them to adopt the change. If the knowledge, attitude, belief and motivation is less, in that case it will affect the people to adopt the new behavior. And the social and the cultural norms. Here peer influence, traditions, gender roles and the stigma. These also will be affecting their motive or interest to change that behavior. Economic conditions, affordability of healthy choices, environmental factors like accessibility to health services, infrastructure and the resources. Policy and governance, laws, regulations and leadership support also will be the factors to affecting the BCC. Health system factors, quality of services and trust in providers. So here is the examples. Here are the behaviors. The people are having that hand hygiene and the respiratory hygiene is poor, waste segregation is poor, food safety, safe clean water, waste treatment, clean toilet, shops box of care. So here, because of this unhealthy behaviors, the disease, they are getting waterborne diseases, foodborne diseases, fecal-borne diseases like that. Okay, so here we need to change their behavior. How we can do the changes? We have to educate the people about the all the diseases can be occurred due to this unhealthy behaviors like diarrhea, pulmonary infections, and this HIV, hepatitis, environmental problems like pollutions. Okay, so like that, and low worker morale. So in that case, we have to change their behavior. If the behavior change, they will be leading to get the safer life. Let me conclude this topic. Fortunately, human beings have in theory control over their contact. Health compromising behaviors can be eliminated by self-regulatory efforts and by adopting health enhancing behaviors. Thank you for watching.